Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 12 additional deaths due to COVID-19. A male in his 60s from Winnipeg region linked to the outbreak at St. Boniface Hospital, Unit E6. A male in his 60s from Winnipeg region linked to the outbreak at Health Science Centre, Unit A4. A female in her 60s from Winnipeg region linked to the outbreak at St. Norbert Personal Care Home. A female in her 60s from the Winnipeg region. A male in his 70s from the Southern Health Santé Sud region. A female in her 70s from the Northern region. A male in his 70s from Southern Health Santé Sud. A male in his 80s from Southern Health Santé Sud linked to the outbreak at Villejueville Personal Care Home. A male in his 80s from Southern Health Santé Sud linked to the outbreak at Oakview Manor. A male in his 80s from Winnipeg region linked to the outbreak at Parkview Place. A male in his 90s from Prairie Mountain Health region linked to the outbreak at Fairview PCH. A female in her 90s from the Southern Health region Santé Sud linked to the outbreak at Rest Haven Nursing Home. I'd like to extend my condolences to their family and friends. Again, we every day we have this reading of a list of 10 to 12 Manitobans that we've lost, and I want to remind everyone that these are not just numbers, that these are Manitobans who are missed and were loved. So our condolences and hearts go out to their family and friends. Our current 5-day COVID-19 test positivity rate is 14.2% provincially, 13.9% in Winnipeg. We have 476 new cases identified as of 9:30 a.m. today. 5 cases were removed due to data correction and bringing our net total to 471 and our total cases to 14,558. Today we're announcing Manitoba is introducing additional steps to improve case and contact investigations. In the coming days, we're implementing an outbound automated calling system. This will expand on current methods for case and contact monitoring. The first phase, the calls will be used to determine if active cases can now be marked as recovered. If a case or contact has a question, they can simply press a key on the phone pad and request a call back from Public Health. If the case or contact is at the end of the monitoring period or has no further questions, the case and contact can be marked as recovered. The second phase, the system will be used to contact cases and the related contacts. This will allow us to be more responsive and reach people sooner. Individuals will continue to receive calls from public health officials. However, the combined automated calls and the current monitoring process will be more efficient and effective in redirecting resources. As in other provinces, this has been introduced safely with guidance from Public Health. The automated call will provide the quickest, most efficient way to get Manitobans information they need and make informed decisions from the proper public health direction. People will be asked important information about testing, self-isolation, and other public health guidelines in a question and answer format with answers provided via the keypad of the phone. Public health officials will never ask for personal health information or personal information such as banking information, social insurance numbers, credit card numbers, passport numbers, or other non-health related identification data. If this is occurring, share this information with your local police department as it is suspicious. Other provinces were able to make progress in this important area through the use of automated phone call system that provides systems with information about testing, treatment, next steps. We believe that this similar system will be a valuable tool for our fight against COVID-19. Going forward, we're going to look at ways to extend this capability to possibly to test results or to other areas over time. This may include things such as email, text, and voice response technologies. We ask Manitobans for their patience and cooperation as we roll out this system, and we expect to improve this over time. Our message has been clear now, and that is to stay home. This is what we require to bring these numbers, and we all know we need to bring these numbers down now. Our healthcare system can't sustain levels of cases like this for much longer. And the best way to reduce our contacts is just to stay home, going out only for essentials. We can't have gatherings of people outside of a household. This includes church services or other type of gatherings. Just poses too much of a risk right now, especially with these test positivity rates. Employers, again, asking to do whatever you can to limit the risk of transmission within your workplace. The best way to do that is to limit the amount of people in your workplace. So if possible, people working from home is ideal. If not, having those measures in place to ensure distancing, hand hygiene, use of masks. We ask Manitobans not to socialize with people outside of your household. Get tested as soon as any symptoms develop and self-isolate. And right now, for most Manitobans, we're advising if there's a single person in your household with symptoms, that entire household should self-isolate pending results. So our healthcare systems right now being pushed to its capacity, and our providers are overwhelmed. They're telling us that they're overwhelmed. And so we can't have these number of cases, these number of deaths that we report to be our norm. We have to act now to bring down the rates of transmission of this virus. We do know how to do that, and we know that because we've done it before. And we'll step up now and do it again. But it does require us all to work together. It does require us all to do, limit a lot of things that we love to do. But right now, the message is really clear. We need to stay home as much as possible, limit the reasons why we leave our house to essential reasons, and the least amount of people leaving the house as possible to achieve those essential reasons. And then we're going to see our number of contacts diminishing, and we'll see soon that case count diminishing as well. So thank you again, and can open up to questions.
To our reporters on the line this afternoon, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. We're hearing that there's a possible shortage of PPE at a personal care home. Who's responsible for making sure that they have the PPE required, and how is it assured that they have enough?
Yeah, I'm not aware of any specifics of this. I mean, I think that ultimately it's the operator needs to ensure that it's accessible and planning for having the right amounts, and then can work with our provincial team to ensure that it's acquired that way. But I don't have any details of this.
And right now, healthcare workers obviously are doing a lot of extra work. How can Manitobans show their support to healthcare workers right now?
I think, and we've heard from healthcare workers on this, and we know that this is a group of individuals who are highly dedicated and have always been there for Manitobans, and they're there for Manitobans right now. And I think what their message is, the best way you can show appreciation to them is to stay home, to reduce the amount of transmission of this virus. And so they are working extra. They're working in, with a larger amount of people with the virus, and they're doing their part. And their ask to Manitobans is to do yours. And right now, that's to diminish the amount of contacts you have, and the best way to do that is to stay home as much as possible.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon, Dr. Roussin. So with this change to the contact tracing, why are we going the automated route? How can we reduce the risk that people will not, offer up complete answers if there isn't a nurse, teasing out the details of where a case might have been or who they've come up, into contact with?
Yeah, so as we're rolling this out, the initial rollout is really for, people at the end of their self-isolation period. And checking in with them to ensure we can take them off the list. So this isn't right now, and probably won't be at a point where it's an automated way to actually do the case investigation to try listing who contacts are. That's going to be still a sort of a specialized approach to it. But for right now, this is rolled out. We have a lot of people who are far past their incubation periods that we haven't officially taken off of our contact list or taken off our active case list, and this is one way to make that process more efficient.
Okay, thanks. I was wondering if you can give a little bit of insight into the new personal care home guidance on infection prevention and control that was posted to Shared Health website over the past 24 hours. So it requires all staff, and I read this to mean, people who are not providing direct patient care, to wear masks during the entirety of their shift. Was universal mask use not previously occurring in care homes? And can you talk about what kind of impact that might have had on the outbreaks that we're experiencing?
We had was a universal PPE was in personal care homes, long-term care facilities, acute care facilities for people who would have contact with clients or with staff that other staff significantly. So over time, we just found that once the virus was in these the places, it was very difficult, obviously, to limit that. So we've just extended who should be wearing these the PPE at all times to those people who we largely consider low risk. They're not going to have that close, prolonged contact with clients or other staff, but we just wanted to do a further risk reduction in these facilities.
From Global News, Joe.
Hi, Dr. Roussin. Just looking for some clarification on the deaths. Some governments, North Dakota, for example, will show how many people died because of COVID and then how many people died with COVID, but it wasn't necessarily the primary cause. So wondering, how do we count deaths here in Manitoba?
Yeah, and so for the most part, if somebody has died and has tested positive with COVID, they're going to be listed as a cause of death, unless we can clearly see that the COVID was not at all responsible for the death. So if COVID was at all related to it, we would consider that a COVID-related death. If there was, say, something like somebody had tested positive for COVID and unfortunately was killed in, say, a motor vehicle collision or something, we wouldn't count that as a COVID death.
Gotcha, thank you. And just wondering if you have an update yet on Christmas vacation potentially being extended?
Not anything specific. Again, it's we're following the situation closely. We're at the biggest restrictions we've had to date. We still, although we're not seeing the test positivity or case numbers climb over the last bit, we're not seeing the numbers diminish as we would like. We are looking at taking advantage of that natural break over the holidays and possibly extending that. Again, it's not so much because we feel there's high amounts of transmission within the schools. It's more that we don't want to go into the holiday season with a very high test positivity rate, where we know it's going to be very challenging to limit gatherings. So it's something we're definitely looking at right now. We haven't landed anywhere, so hopefully we'll have some more definitive news on that shortly.
From the Brandon Sun, Michelle.
Yes, good afternoon, Dr. Roussin. I'm just curious, assuming it's a big assumption that when December 11 rolls around and our numbers are down, what kind of reopening scenario are we looking at? A very, very slow rollout, or I'm just wondering about the scenario.
That's right. And so when, and it is a when, we will be able to lessen these restrictions. We don't know, exactly when that will be, but we will be loosening these restrictions at some point. We're going to have to do it in a very cautious manner. Much like we did in the spring and early summer, in a phased approach. And follow our numbers quite closely. The prerequisites for that is a diminished test positivity, diminished case numbers, and as well as a clear relief of the strain on the healthcare system. So that would give us that ability to loosen things again. So don't have any specifics to look at. It's something we're always considering where we would go first. But at this point, we have to focus on getting these numbers down.
Okay, great, thanks. And for my second question, I'm going to apologize in advance. I'm going to bungle a word. So is Manitoba making use of wastewater COVID epidemiological analysis, such as in Saskatoon and other cities? A toxicologist in Saskatchewan is quoted as saying that since feces from infected people sheds particles of the virus, they can use a special model to roughly estimate how many cases may be in the community, potentially before these people have symptoms.
Yeah, so this is something that's being worked on. We don't have it applied routinely right now. So this is really, something that may be beneficial when we don't have a lot of transmission of the virus as an early warning, right? So it wouldn't help us right now, say, testing in Winnipeg. We know there's a high level of transmission going on. As we get the numbers down, if we have, say, remote communities or other communities that really have no activity, this might give us an early warning indicator that something is starting to happen there. So there are uses for it, but right now we don't have a routine use for it here in Manitoba.
From CJOB, Will.
Good afternoon, Doctor. Often the first question that gets asked when we hear of COVID-related deaths, and particularly those for young people, is did the person have underlying conditions? And as you mentioned yesterday, the answer is more often than not yes. So how do you balance reporting the facts but not minimizing those deaths?
That's right. And I think this is the, a basis of a lot of misinformation out there. That somehow, because a large proportion of COVID deaths have underlying medical conditions, that it somehow minimizes the impact of COVID or minimizes the impact of those deaths. If you look around Manitoba and consider just how many people are walking around with some sort of underlying medical condition, whether that be hypertension, asthma, COPD, other kind of cardiac conditions that are doing just fine, right? Their life is going just well. They acquire COVID, they're at an increased risk of a severe outcome. There is no reason to think that a death caused by COVID in those situations is somehow minimized. We know people who have COVID who had severe underlying medical conditions, but again, their disease natural history was one thing. COVID altered that. COVID, in many of these cases, caused a severe outcome, a death, much earlier than the natural history of that condition they were suffering was going to. So I would really caution people to think that when we talk about underlying medical conditions, this doesn't minimize the impact of COVID at all, and it most definitely doesn't minimize the loss of that loved one to their family.
Thank you very much for that. I'm wondering, could you also tell us what sorts of medication are being used to treat COVID patients? And besides equipment such as ventilators, do we have other methods of treating people right now?
Yeah, and so I mean, if you think about the vast majority of people who are in hospital for COVID are there because of they're not getting enough oxygen into their blood, and so treated with supplemental oxygen. That could be on the ward and what we would call non-invasive oxygen, and then some might require ventilator support on that. We know that there's a large inflammatory component to COVID, so essentially all patients that are in hospital that are receiving supplemental oxygen will receive a steroid, usually dexamethasone. And in really severe cases, there's some indication, you may have heard of a medication called remdesivir, and that would be people with very severe disease with it. But that's the typical type of regimes that are used that are focused on COVID.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin, Scott Billick, Winnipeg Sun. First question, going back to this recovery or the new system that you guys are rolling out, can you kind of give us an update on what that active caseload is right now? I know it's backlogged due to the lack of recoveries being reported. Do you know kind of a ballpark figure of the actual active caseload in the province?
And so like the active cases that are just, that are listed is 8,677. If we use that proxy, that 10 days after symptom onset, after diagnosis and excluding people from in hospital, that proxy indicator is 3,363.
Thank you for that. And just a question going back to schools. Given the restrictions that we have now, I guess at what point would if the cases continue to be where they are right now, at what point would the focus shift to schools being that transmission? Even if you're not seeing symptomatic transmission in school, what about asymptomatic transmission? Maybe kids aren't showing the symptoms, but they do have the virus. They're taking it home. Family members are getting sick. I assume that with the lesser number of contacts, that might be easier to trace at this point, to some sort of school transmission, even if it's not symptomatic. Will the focus shift to that at some point then, given kind of the lockdown, I suppose, that we're in at the moment?
Yeah, and so I mean, this is something that we've been looking at, and with all the things that you mentioned there, I think are all reasonable things to look at. Despite that, we do contact investigations. We do look at what cohorts are affected through school. So we still don't think that there's a lot of transmission that's occurring in schools, but we are at the highest restricted level. We need to see these cases coming down, and if not, despite being at the highest restricted level, then we still need to look for other options. And you can see that if we hit a test positivity rate that's really high, like we've seen in sort of the Hanover area there, we weren't left with much of a choice but to go to remote learning when you see that much transmission going on. And in looking at this year, if we just don't see these test positivity or case numbers going down, then we do have to consider things further. And one of those approaches, and again, just something we're looking at now, one of those approaches is to take advantage of that natural break that we'll have over the holidays and consider expanding that.
From CBC Radio Canada, Amelie.
Good afternoon, Dr. Roussin. I was wondering if maybe you could tell us which, you said some other provinces have a similar system for contact tracing as the one you mentioned earlier today. Can you please tell us which provinces?
Yeah, you know what? I don't have a great a list of that in front of me. I know we've worked with a lot of different stakeholders to get this, and some might use it in some capacity and use it in another. So I don't want to misspeak on which province there. So we can probably get that list to you quite easily, though.
Okay, thank you. And with what the Premier said this morning regarding authorized gatherings in Quebec for Christmas, is there any chance that Manitobans would be allowed to to have family gatherings for Christmas, as you said earlier that you're maybe planning to add two weeks to the holidays for children?
Yeah, as things look right now, with this test positivity rate, we just could not advise that people have gatherings outside of their household members. And so we're a bit of a ways away from the holiday season. It's quite possible that we could see a good trend by then where we might be able to provide different advice. But if it's advice that people are going to rely on and they need it right now, that advice is to not gather outside your household, to keep those gatherings as minimal as possible, to look for alternative ways to celebrate, such as virtually. But as we put all these measures in place, as Manitobans step up, we may be able to alter some of those recommendations. We're certainly not going to be at a holiday season that's like any other, where you can have a large family gathering. But we're really going to try to get these numbers down to see if we can't have some remnants of a holiday season outside of our household.
From CBC Manitoba, Bart.
Hey, Dr. Roussin. Before you were on, the Premier stated that the initial worst-case projections for Manitoba's deaths doesn't look like they will come to pass. You didn't get into specifics. Could you provide some specifics there on what the Premier was talking about?
About deaths, so when we do modeling on there, and most of our modeling numbers, we do those 4 scenarios you probably heard me talk about, where it's we have no public health restrictions with no compliance, all the way down to very strict public health compliance with great public health restrictions with great compliance, and we model those numbers. And as we went into red, we're actually at the sort of that worst case where we had the numbers were climbing as in a sense that we had no public health restrictions and no compliance to our messaging. And so with that, we saw, increasing hospital bed utilization, increasing ICU bed utilization, to where, sort of mid-December, we're really reaching a lot of that capacity. As far as deaths go, when we do the modeling, our model never really worked out deaths. But it's just more of an extrapolation where you could look at our death, our case fatality rate of 1% to 2%. So when we're calculating that out, we really focus our numbers on healthcare capacity as well as the overall numbers. So I don't have any detailed fatality numbers to provide you.
Well, it's helpful enough to say that the capacity crunch in hospitals is expected to peak in mid-December, as long as I heard that correctly. Moving on, and you would tell me if I didn't, I hope. Moving on, I just want to follow up on something I asked you about yesterday. It seems clear now that some of the delay we're seeing in contact tracing isn't with your public health nurses, but in that public health information system data entry after the labs get the cases. And I asked the Premier early, he said more resources are going to be added there. Who's doing that right now, and how can that 3, 4, 5 day gap be sped up?
Yeah, so we did have a gap with that in the past. That is not a 3, 4, 5 day gap. That one there is almost all of the labs now are being entered within that 24 hours of being received. So remember, we'll get automated reports from the labs as they're getting these positives reported. So we have clerks entering until about 8 o'clock at night. And so there'll be some labs that'll come in after that won't get reported out, obviously, till the next day. When we first started seeing these 400 cases per day, there were days where they just couldn't get it all reported out. But right now, that's not a rate limiting step in it. And it's certainly never been 3, 4, 5 days just to get it entered into the system. So they're continuing to increase that capacity, but from right now, there isn't a significant backlog at that end.
From the Canadian Press, Steve.
I'd also like to ask about modeling. The numbers the last few days are quite high, but the average over a 7-day period is I don't want to use the word plateauing, but it's been relatively stable for a while. When you go back 2 weeks to when you were thinking about imposing severe restrictions, what did the modeling look like 2 weeks ago compared to where we are now?
Yeah, and that's right. And so we're going to have some, updated numbers that we hope to even present quite in the near future. So if we look at, a few weeks ago, our doubling time was at 2 weeks. As we updated it, we see that now about 3 weeks. The modeling that we saw in the past was sort of what I was discussing there, where we saw real capacity issues, sort of mid-December, but that was, all that time expecting the increase in case counts. And so you're right, we use certainly if you plot out the cases per day on a graph, it's much more flat now than it was. We're not seeing that exponential growth. So already as we update our modeling numbers, we're going to see that all that shifts, right? We're not seeing all those numbers were dependent on the exponential growth, but we're still seeing over the last couple of weeks, it's still around that 400. Now, no doubt we can't sustain that number, but at least it's not climbing still.
And I wanted to ask you a question about the rapid testing. The province announced that it was going to roll out testing mostly in remote communities where there would be some delay in getting the test to labs. Has there been any thought, like Ontario, to do it widespread in long-term care homes as well? And if so, have we made any progress on that aspect?
So we've been doing rapid testing for quite some time in the remote communities, especially with the Gene Expert. We're now using the Abbott ID in some of these remote areas as well. As far as personal care homes, we do asymptomatic testing as part of outbreak investigations in those areas. We are looking at ways to do more surveillance testing in those areas. But we haven't landed on the approach yet. Remember, it's when you're testing asymptomatic people, the negative test doesn't have a lot of value in it. It has a very short-term negative value. So if you're testing, say, people routinely, but doing it once a week, well, there's many days in there that negative is no longer really advising you of anything. They were negative on the day you tested them. The next day they may not be negative. So if you're not testing them again for a week, probably some value that you're doing routine surveillance, so you might pick up on some, but it is in no way making it eliminating the risk because that negative value is only good for maybe a day.
From CTV Winnipeg, Michelle.
I'm wondering about the contact tracing calling system. Why are we implementing this now? Was there something that kind of was the straw that broke the camel's back, or why didn't we do this earlier?
Yeah, it was just it's again the response, the multi-level response we've had to the requirement to increase our capacity. So we increased our capacity of contact investigators, whether it be public health nurses, Stats Canada, Canada Red Cross, and then we want to just further increase that capacity, now taking off some of the daily monitoring, or at least the ending of the incubation periods with this automated call. So it's all part of the same process to expand our capacity.
Okay, and I also have a question. The epidemiology report shows that over 100 women who are pregnant have contracted COVID-19. Do they pass on the virus or the disease to their little ones? And is the baby that's in hospital, was it congenital?
Yeah, well, I won't speak to any specific cases. Certainly there's, newborns will be at risk for acquiring it for a number of reasons, and that's just the close contact with an infected person. So there have been cases of that, but I won't speak to any specific cases.
From City News, Stephanie.
Dr. Roussin, looking at the numbers as we see them right now, do you think and do you believe that we will extend these restrictions on December 11th when that decision needs to be made?
Yeah, well, I mean, I would say that with certainty, we're going to have to extend some sort of restrictions. You know, we just could not be in a place by December 11th to lift our restrictions. Whether they'll look exactly like the ones we have in place now, I think we still have some time to see some of these numbers moving. But no doubt we'll have to extend restrictions in some way.
Okay, and I just wondered if we could get an update on the Steinbach area. The test positivity rate there was 40%. Is that still the case there, and how concerned are you about that area?
Yeah, well, I mean, we are concerned of that. We saw a lot of high levels of transmission. We saw, very high demands on the local health facility. And so I don't have today an update on that test positivity. What we do have done is try to increase the testing capacity in the area as well. And probably later this week we'll take a look and see what that test positivity rate has done.
From the Globe and Mail, Karen.
Thank you, Doctor. The Ontario government announced yesterday that it will require weekly surveillance testing of staff in long-term care homes in those communities that are hard hit by the virus, so those areas designated as red, orange, and gray zones. So this would be once-a-week testing of staff. Would you consider doing anything similar to that?
Yeah, and so I mean, there's no doubt that the personal care homes, the long-term care facilities are some of our most at-risk populations. We can see that from our numbers and the unfortunate amount of deaths we've had related to outbreaks there. So certainly we're open to making those places safer. The routine surveillance testing is one option to that. Again, we sort of spoke about some of the limitations on that having a negative test is only really relevant for that day, maybe two. But if you're waiting again for another week to test, then you have a pretty long period of time there where that test is no longer relevant. So doesn't mean that that's off the table. I do think we want to come up with ways to make those places as safe as we can, and a testing strategy is certainly not off the books. We just haven't landed on anything specific yet.
Okay, and just as a follow-up, I mean, I think, these kind of policies are more geared just because so many staff are asymptomatic who do end up testing positive. So this is a way of catching those cases early. I think that would be, as opposed to, those who are negative. It's more to catch that needle in the haystack and detect the staff member who actually has the virus but is showing no symptoms.
Yeah, ideally, yes. For that to actually be fully effective, you need to be doing testing either every day or every second day. And so that's very difficult to achieve. And again, hard to know whether that the effectiveness of that would pan out with all the resources that you need. So certainly not off the table. And we're definitely looking at our strategy for that.
Thank you, Doctor. We have time for just a few more questions. Please proceed.
Hey, Doctor, is there any chance you can break down the percentage of school-age kids' COVID cases by community transmission versus school transmission?
Yeah, I mean, we could. I don't have that in front of me. I think we look at that overall because that's how we're saying that we're not seeing very much transmission within schools. So actually, the proportion of what we would say is community acquired is very high for school age kids as opposed to school acquired.
Thanks for that.
Yes, Dr. Roussin, I'm hearing reports that in Reston, 20 of the students from school have now tested positive. There are positive cases in the community. Are you aware of the situation in Russin, and can you update us on that?
I don't have any specific details on that.
Okay, thank you.
Dr. Roussin, since we spoke yesterday, I asked you yesterday about the contact tracers at the WHO are not allowed to work from home. Started canvassing other public workplaces. They don't have all the data yet, but it looks like there's a lot of government offices that don't let their people work from home. So people look to you. You're telling private employers, let your workplace work from home. Why can't more public sector managers let their employees work from home?
So, well, I mean, my message is to everyone that if it's feasible, if you can still get what you need done by working remotely, people should consider doing that. There might be plenty of occupations or areas that it's just not that feasible, or you can't get what you need done that way. Then they'll have to think of ways doing it safe. But yeah, I mean, the message is if you can work from home and get everything done in a reasonable manner, then all employers should consider that.
Hey, Dr. Roussin, it's
Dr.
Danielle,
Roussin, we've heard that
from the Free Press.
recovered means
I
no longer
wanted to
testing
ask about
positive.
the Parkview Place personal care home. That facility has been in an outbreak for 10 weeks, and Rivera said that there are still active cases within residents. So why hasn't public health been able to control transmission after 70 days?
Well, I mean, public health isn't, running the outbreak response within these facilities, right? They have infection prevention and control experts that are running that. So, public health can provide advice, but they're overseen by the region. We've heard from the region. So, for most of these questions, best to direct them to the region on what's occurring in those facilities.
Dr. Roussin, do we have any cases that flow from the Steinbach rally 10 days ago?
Not that I know of. That would require that to be, picked up on a contact investigation, for the case to devolve that information that they were at the rally. So there might be some deterrence to actually, speaking about that, but I'm not aware of any cases.
Dr.
Roussin,
Roussin,
you talked a lot about
no longer test.
Go ahead.
We've heard that recovered means no longer testing positive for the virus, but I'm wondering if you've heard of any cases where neuro or respiratory issues are being described by individuals maybe months after they've had COVID.
So testing, recovered doesn't require a negative test. That would take, sometimes a month or longer to get that. So the PCR test, again, doesn't test for viable virus, just tests for remnants of virus. So a recovered person is almost always someone who's 10 days post-symptom onset, who's no longer have a fever and the symptoms are improving. So that's the recovered component. So certainly in the literature, we're seeing, people with symptoms and concerns that are lasting far after recovery time. And these are, kind of reports now, so we're learning more and more of that. It could be based on the multi-organ nature of the virus, the inflammatory nature of the virus. And so these are things that we're learning a lot about. Now, none of these are reportable illnesses, so, so public health isn't compiling any information on that, but there is growing information in the literature.
Dr. Roussin, do you believe that businesses need to be called out publicly when they're flouting public health rules?
Yeah, I don't know the answer, what the right answer to that is. I know that we all have to step up as Manitobans, and that includes businesses. And so I know that through the first wave, we did a lot of education, and that was very effective. When we talked about those enforcing it, the public health inspectors, they'd go one time and see a violation, discuss what was wrong and what needed to be done, and it was corrected. Now being 9 months in, I think there's a lot of fatigue with following these rules, and we certainly see a lot of examples of businesses and individuals trying to work around the orders. And so we really want to get that message out that it's important. We have more enforcement on that. I've never, really liked the approach of, of naming or shaming that way. But, we're at a very critical point right now. We need everyone to step up, and, we're going to be enforcing these in the near future, or continued for the foreseeable future, because it's just so important that we get everyone on board.
Thank you, Doctor, and thank you, everyone. This concludes this afternoon's media briefing.